Hello, everyone. This is Dr. Mary Lauder, and you are listening to the Since You Put It That Way podcast. It's the show that examines various health, wellness, and medical topics from unique perspectives. We will be having discussions and guests that will cause you to pause and consider, well, since you put it that way. Hi, everybody, and welcome to our next episode of Cosmic Health and Wellness. It's the dynamic duo, Carol and Mary, the paradox, the two of us. So, Carol, how are you today?
I'm very, very good. Yes, we are a paradox, but you know what? We're not completely opposite of each other. So this is really a good thing.
Exactly right. I'm sure we're probably more two peas in a pod.
Yes, that is a understatement. Yes.
Yes. So, well, we're going to get right into it today. And we're going to go for some ideas. I've got notes. I'm going to always have notes because our conversations are so layered and textured. It's so fun. Understanding energy medicine is going to be what we're going to talk about today. I think there's a lot of misconceptions. I think there's a lot of myths. I think there's lots of ideas of what woo-woo is and isn't. And I think it's really good as medical intuitives, both of us, to really explain this and really discuss what this is and the validity of this type of approach to our health, wellness, and our life.
Exactly.
Yeah. So if I'm gonna start asking some questions of you, like number one, what would be your understanding of the history of energy medicine?
Well, probably the most obvious answer to that would be the Chinese medicine approach, from the standpoint of using herbs, which has its own vibrational qualities per plant and the type of herbs and the way they're mixed together. But even more importantly than the obvious part is the acupuncture. And then, of course, we get acupressure and we get chakra balancing and things that have evolved off of that. But if we really go back and we look further back into history around energy medicine, we're going to find that it's been used forever. And when I say forever, I'm talking about literally forever. So if we went back and we looked like using the Egyptian civilization as a kind of a set point for it, is that we would find that Imhotep, who was both a builder and architect, but also revered as a great Egyptian physician. And in the schools that he would teach, the mystery schools around becoming basically a healer, is that they would use in their approach, use light. They would use the sun. So they would say, especially for certain ailments that had to do with skin afflictions, as they were called, then what it would be is it would be like a prescription would be like, okay, well, you need to do 15 minutes in the sun, and then to let the vibrational qualities, energy qualities of the sun, and then, of course, the heat that comes from it, that is part of the next part of energy medicine, is it's bringing whatever is inside up to the surface, which of course heat does when it touches the skin. So there's that quality. So we really have to go back in the history of it and say, okay, let's go back further. And even in teaching in the mystery schools with the metaphysicians, as they were called, they would use sound and to be able to really, the term that was used was recalibrate the body, and to be able to understand that we are vibrational in nature. And that was part of the real impetus of medicine in the Egyptian civilization, is that we're energy. And that illness is a combination of not only what happens in the physical body, but it's also what happens on the different layers of who we are. So in that approach as a metaphysician in this curriculum was really about, so let's do what's obvious for the physical body, because that's the most uncomfortable, but the approach of the Egyptian metaphysicians, and then we can go on in, and even Hippocrates, if we went into considered the father of medicine, actually went in and looked at the vibrational nature and how can we connect with that, and how can we what tools do we have to be able to really attune, align, create harmony, whatever words we like to do, manage the discord, to be able to energetically and physically put us together. And that's what healing is.
Mm-hmm.
So that's really when you go back and look at it, and especially from, kind of who I am as a medical intuitive, it was like, okay, let's go in and find out everything. So that's where, from my perspective, it's been, I guess the point of it really is, Mary, and the question that you ask is the fact that it does have history.
Mm-hmm.
It has been used for a long time,
Yeah.
and it has been very effective in what it does. Is it like a pill that you get a quick fix? No.
Right.
And you know me, I'm not anti-medicine, I'm not anti-doctor, but when we look at illness versus disease, which is something happens to the body, when we look at illness, we have to really look at the wholeness of who we are. And we're energy first, and we're
Mm-hmm.
matter second.
Yeah.
And that is truly, I guess, if I had to, from my own perception, sum it up, that's what energy medicine is. It says, okay, your energy first
Mm-hmm.
and your physical second.
Mm-hmm.
And we can deal with the physical, but if we don't heal the underlying contributors, then we don't heal. We mainly just cure or put a Band-Aid on a boo-boo. And energy medicine doesn't do that.
No. So are you saying then too that illness is different than disease?
It is.
Okay.
It is. So if we look at disease from the medical perspective, and of course you're the physician, and here I am kind of preaching to the choir,
That's okay.
from the standpoint, if we look at medicine, and the approach is disease is an anomaly in the physical body.
Okay.
It's something that is symptomatic. The symptoms are very clear. You can connect the dots. You can connect it to how medicine sees that physical part of who we are, which is wonderful, but they see it as a breakdown in the physical body.
Mm-hmm.
And if we looked at the way the metaphysicians looked at it, disease, dis-ease,
Mm-hmm.
energetically is that we have a discordance in that energy quality of who we are that is ultimately manifesting into the physical body.
Okay.
Illness is all of us. It's all of it. It's the mental, it's the emotional, it's the energetic, it's the physical, and it's the part that basically goes in, and we've heard this before, is we become what we think, and our body imprints that.
Yeah.
And so when we look at illness, we look at all of it, and as healers, as you and I are, and as medical intuitives, we just give people a bigger picture.
Yes. Yes. And it's interesting because in osteopathy, we learn about ease versus disease. And the founder of osteopathy, A.T. Still, he was probably a mystic, I would say, in addition to a physician, in addition to, and he was a preacher as well. And his thought and his philosophy of medicine evolved out of losing a number of family members to influenza, in an epidemic of influenza, and just the medicines not working. And it just
Exactly.
made him look deeper. And we always learned that it's ease and dis-ease, and that the body's seeking homeostasis or balance.
Correct.
And so, yeah, I thought that idea, the difference between illness and disease is important because we talk about things such as mental illness, and then we talk about physical disease. And that from what I'm hearing you say, that's not correct. It's really anything that encompasses the integral, the whole, which would be the illness. And then the
Absolutely.
disease is then the reductionistic, or the reducing it down to the symptoms, which are what the patient experiences, and the signs, which are what the observer sees or palpates or finds in the patient.
And if those symptoms match a defined condition or disease, then what it is then the approach of the physician is that, okay, these connected on these levels, therefore it is, or if it's not clear enough, then they request more testing to get the bigger picture.
Right.
And one of the things that, again, that I found with osteopathic medicine that I really gravitate to is the fact that it sees everything is connected, whether it's working with the physical body
Mhm.
or it's working with the muscle structure or the skeletal structure, everything is connected. And it even looks beyond the most obvious to ask more questions.
Yes.
And it's things like osteopathic medicine is something as simple as, have you been under a lot of stress?
Mhm.
Have you been dealing with a lot of emotional depression? Have you been dealing with the things? And that's the way osteopathic medicine looks at it, is they say, okay, so let's see what we can find that's a common denominator.
Right.
And then
Right.
how is this connected to everything else?
Yes, because we learn structure and function are inherently related. So structure can
Correct.
be anatomy, and anatomy of anything, anatomy of any system, anatomy of any, obviously the gross anatomy being muscles, ligaments, tendons, nerves, lymph system, etc., circulatory system, and then the function, which is your physiology, and they're inherently related.
Absolutely.
And that the body has the inherent capacity to heal,
Yes.
and that we need to restore balance or homeostasis to the body. They also talk about the artery in terms of circulation. I would broaden that a little bit more and just say flow of energy that needs to be balanced. Um,
Absolutely.
and so, really, and I was reading a textbook on this. It's an interesting textbook called The Scientific Basis of Integrative Health. And it's like dynamite. It's an amazing textbook written by Dr. Leonard Wisniewski. And he's just really digging into the nitty gritty on this. And then he goes, well, what is energy medicine? He says, well, it's basically if a person talks, the sound waves go out,
Yep.
bounces off the eardrum, then you've got a mechanical um, energy because of the three bones in the ears that process those vibrations. Then that sends a mechanical signal into the ear, which then sends a neurologic or electrical signal, which then makes a chemical signal to go up into understanding what you're hearing into different areas of the brain. And absolutely, and then you look at the person who's talking to you, if they're in front of you. Absolutely, every one of those steps is an energetic exchange.
Absolutely. It
Yeah,
is. Because sound is vibration.
exactly.
Words are vibration. Everything that we hear is vibration. And part of the dilemma that we run up against in looking at energy medicine is the way that it was first categorized as being alternative.
Yeah.
Well, immediately that separates. And then the other part of it is to recognize that to look at it from the standpoint that it's all connected.
Right. I'm just laughing about alternative. What's the alternative to being exactly what it is? Being
Exactly.
exactly what it isn't. Oh,
Exactly. And then in the evolution of trying to integrate the different qualities that the metaphysicians used, and even Hippocrates, the father of medicine, and we can go on and on and on, used, was that what it is then we went from integrative to complementary. Well, okay, well, now this is a step in the the right direction, right? And then now we've reached the place where it's integrative. Well, this is a real truth of what it is. It's an integrative process.
exactly. And it's
So
never changed.
yeah, so a lot of the obstacles that we run up against, and all energy workers run up against, whatever their healing modality is that they up against the fact that it was first labeled as alternative, therefore unknown, therefore not measurable, therefore like don't do it unless you absolutely have to because we know this works. And that's part of the challenge that we're still overcoming.
Right. Yeah, those stigmas are pretty deep. I'll say that.
Well, they are, and especially because, once science entered into this curing, healing outcome,
Right.
it's separated.
Yeah. Well, it was so easy to reduce because I think people like what's black and white. It's easier to identify and it's easier to just be told something versus living kind of like with the unknown or what could be seen as the mystery because we haven't maybe measured it yet. or figured out how to measure everything. But even thinking about the brain waves when we're looking for a diagnosis, here we go, of a disease, epilepsy, which is an abnormal brainwave activity that causes seizures, that's energy.
It is. Well, if you stop and look at us and you look at, and I'm going to go the woo-woo part of it, like Correllium photography or even SPECT scans or thermography, those are all imaging systems of energy. And that energy could be heat, which would show up as red, or it can be varying degrees of it. But we are energy.
Yeah.
And if we were to look at who we are from that perspective first, then what I found over the years as a medical intuitive is that if a person chooses, all people would like to heal. The body is constantly in a healing mode. It's the most sophisticated healing machine really ever created. But if people realize that if they are struggling on the physical level and they've tried so many different things and it's not giving them the relief that they're looking for, then maybe we go in and look at the energy part of who we are. Or maybe we go in and look at our emotional patterns, or maybe we go in and look at our thinking patterns. And one of the things I found as a medical intuitive is if you can present someone a whole picture of what's going on, then what the person can do is say, okay, well, I'm doing this, but I'm going to try that.
Right.
And then what they do is they try it and they make a commitment to do it and they stick with it, then they get better.
Yeah. And
because we're all energy.
Right. And just with a lot of the chronic illness, what I've found is I've got to dip into the emotions. I've got
absolutely.
to put my toes into the area where trauma has been, or traumatic events that have caused trauma effects in the body. Because without that, folks don't get well.
They don't.
They only go so far. And so then they keep recycling ways to physically treat things, and then they just get frustrated.
Well, and then the risk of that is two things. One is that the brain, as sophisticated as it is, chemically normalizes what it experiences the most.
Yes.
And then the other part of it is that the brain itself wants to actually not think. It wants to be reactive. It will think if we push it to, or we try to expand it or change a perception, which is what energy medicine does and osteopathic medicine does. It says, okay, so here's just a bigger picture. But when we do that, the mind is so conditioned to stay with what's tried and true.
Yeah.
That it's like a part of us says, okay, well, you're going to change mind. But if it's normalized chronic pain, then what's going to happen is anytime we're not in pain, the brain is going to again go in chemically and energetically, tell the body something's wrong. Boom. Now we're back in pain.
Right. So it's almost like a radio dial, isn't it? Because you
get
off the station and it's fuzzy and you want to get back on the station because you're used to where that station is. So your body's attuned to that station.
Absolutely. And if you want to change that pattern, you find a new station.
That's right. Yeah. 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 So, okay. So we're all energy and I'm all ears. Let's carry on. So why do you think the mystery is important in our human experience? Because we don't want to reduce things or just say, off our collar, off our, shirt cuff, hey, we're all energy, whatever, get over it, just get on board. I mean, there's this concept of how things work. And, as you mentioned, the body is so dynamic. And the other thing it is so accommodating and forgiving because of how many things we do without awareness, right?
Correct.
And it just keeps on going because if we really...
It's a miracle. Literally, it is a miracle.
Right.
I always say to people, if you want to see, hear, touch a miracle, give yourself a hug.
Yeah. Yeah. Well, and even looking at some things with genomics, we've got I think it's 6 billion base pairs in our
Yep.
DNA. And we replicate those about every 2.5 to 3 days. And as we replicate 6 billion, I feel like Dr. Evil from Austin Powers, billion, 6 billion base pairs, we get on average 6 errors. That's
Yep.
it.
Amazing, isn't it?
It's better than a computer. I mean,
Absolutely.
it's better than, but to think about that, now sometimes they're big errors, and then sometimes they're errors that occur time and time again, or 6 plus 6 plus 6, that then eventually there's a change and that's handed generationally, or we get two groups coming together, mom and pa kettle, that give kid kettle something. I've got my folks to thank and forgive for some of my genes, I'll tell you what. But that comes together, and it, then that's where things happen. But the body every day going about, and we used to say about 3% of the DNA, we know what it's up to. The other 90%, 7%, we think, oh, it's junk. No, actually what they're finding is that part supports the DNA, the protein synthesis, and
Correct.
the part that replicates, and the part that makes the other DNA, and the part that makes the protein to keep the cells going is also supported. So those other fragments and parts of the DNA are literally the supporting actors. And that's actually equally, if not more important, to keep that part of the DNA healthy as it is the part that replicates or the part that makes the proteins.
Absolutely.
Yeah.
I was thinking as you were talking about the word mystery, and, the part of us as humans that we need that. Well, within the mystery is the unknown.
Yes.
And whenever we touch that unknown, it immediately sparks a part of who we are. We can call it soul, we can call it divine, we can call it whatever somebody's comfortable with. But what that does is it takes us back, and immediately our imagination becomes involved in the process.
Yeah.
And then once we start connecting with that imagination, and we can call it intuition, there's a whole bunch of words with it. Then what that imagination does is it starts to present possibilities. And those possibilities chemically change the neurology of the brain. Yes. And how the body responds. Right. And then the next step of that mystery is the creativity. So mystery really is the impetus to learn. It's to evolve, it's to grow, it's to expand the way that we see things. And without that mystery, then, and that's one of the things that, my son-in-law and I were having a conversation about AI, and we were talking about the fact that people are so concerned that it's going to take us, take over we humans and everything. That's not possible. Okay. Because it's a machine. That's true. You can try to integrate emotions. That's true. But you can't replicate the energy, and you can't replicate the mystery. Mm-hmm. So from this particular standpoint, that's what makes us unique. Yes. Yes. The unfortunate part of it is, again, this has to do with the evolutionary processes, is that mystery has been connected to occults or witchery or just a whole bunch of negative things because it wasn't understood.
You couldn't control people.
You couldn't.
No.
You couldn't control people at all. And in fact, that's the very thing that mystery provides, is the ability to control oneself, to be able to really be in alignment with the authenticity of who we are, kind of that maverick individuality, non-conforming part of us. That's the mystery.
Right, right. But even just the contentment of being able to be who you are without having to, I think of, to me, as soon as you said that, I'm like, oh, I'm relieved. I can just be me and just relax into that.
And our bodies and brain and chemistry responds favorably because now we're not in that underlying tension of stress. And if we really go in, and one of the things that even in the the evolution of the metaphysician is that stress is the common denominator of all illness. I didn't say disease, but all illness. And if we think we're not stressed, but our body is responding in a chemical stressful way, that becomes a pattern.
Yes.
And then it becomes normalized.
Yes.
And there's where we get the challenge, the mystery of the healing component is that how do we introduce to the brain, not the mind, but the brain, a different perception, mystery, that it can react and respond differently.
Yes. So what if we introduced self-compassion?
Absolutely.
Loving kindness.
That's much easier than self-love, right?
Yeah.
Because self-love, we're trying to figure out what that means, but compassion, self-compassion, self-tenderness, self-acceptance. Oh my goodness gracious. When we hit that place where we just, laughingly say to ourselves, like, well, it is what it is, and so forth, everything in our physical body instantaneously changes into the healing mode. Yes. Energetically, it's spontaneous.
Yes.
Physically, it's a little slower, but it gets there.
Right. Well, it's thicker.
True. That's a great way to put it.
We won't go to all of those reasons.
That's a lot better than dense, honey. I like that. I could use that.
Exactly. Fair. And moving right along. Exactly. Once I was dense and then thicker I became,
Well, that has to do with aging. I hate to say that, but this may be true because chemically our body goes into a different phase and wants to hang on to things a little bit more.
It does. But there's, yes. And accepting that, it's interesting because I'm older now too. I'm 60, I'm going to be 61. It's like saying I'm 8, going to be 9. I'm 60, going to be 61. And it is different. I mean, and even thinking I don't feel 60, and there's lots of interesting studies that say people typically feel 20 to 30%, years less than what they are,
Right.
It's just, because I figure I feel like I'm about 42, I really do, but.
Well, and if you stop and think about it, the real job of the brain, not the mind, but the real job of the brain is to keep the body in a state where it survives.
Yes.
And if we start to experience, as we do in our humanness, the changes in the chemistry of the hormones, then the body exquisitely changes its metabolism, changes the way that it responds for preservation.
Yeah. Well,
and so we may see it as being
for a long time.
I'm with you on that one too.
I always said I'm good in the famine and flood because I can float and I've got some padding. So I'm going to be, I'm your gal, and I'm good in the foxhole because I can.
I laugh and say that the extra padding is as if we fall, we don't get hurt as bad. So there you go. It's always a positive thing. The body's always looking out for us. That's the main thing.
Exactly. Rare will I break anything.
But energetically, what you said that you feel like 42, energetically, we energetically are still have the capacity to be that energetic being before we were born, when we're in light. Nothing changes there. That part of us remains constant. It's always in that healing and always in that high vibrational state and always looking for well-being, and that doesn't change.
Yeah, right. So so say you get a client, I get a patient, and they are new to this concept of energy medicine, even though it's the constant standard and the state that we are there in, no pun intended. What 3 steps could you give them, or maybe 3 key points to say, hey, this is why this is normal versus, not a bunch of biochemistry or a bunch of prescriptions and diagnoses? How would you maybe introduce a change to their paradigm?
Well, first of all, what I do is, again, kind of go and talk about energy, and that's who we are. And then I share with them how illness is a discordance, it's a disharmony in that energy part of who we are. And it's influenced by our thoughts, our emotions, the food that we eat, the lack of water, whatever it may be. And I explained to them that the difference with working from the perspective of true healing is to recognize that if that discordance is present in the physical body, that you can approach that. Or what you could do is you could go and you could approach these other parts of who you are. And one of those parts is energetically. And while it isn't necessarily measurable from that scientific standpoint, even though we do have instrumentation now that can measure the biofield of who we are, that what it is that you will feel different. And I explained to them, how will you feel different? You'll feel hopeful. You'll feel committed. You'll feel enthusiastic. So basically, I work with that. The other thing that I do is something very simple. It's been around for a long time, is I have them just, even though we're doing it over the phone, I say, okay, so let's just ground energy into your psyche, your mind, and we're going to create a folder. And that folder is called energy. And what I want you to do is I want you to take your hands and I want you to rub them together until you start to feel a heat build up. And then once you feel that heat build up, then what I want you to do is just, and I'll say to them, there's no fail, so don't worry about this, because your mind is in there like, what am I rubbing my hands for? I'm not cold. So rub your hands, and then you start to slowly pull them apart, and you'll start to feel a tension.
Yep.
And then what you do is you can pull it apart, and you can feel that tension even more.
Yes.
And you'll reach a place where you'll pull it apart, and your mind goes, nope, not going to work. And then you can put your hands back together. That's energy. That's energy. And what you can do is, as you want to do healing, if you want to do your own energy healing, and you have a part of your body that is maybe hurting, what you do is rub your hands, get that tension going, and then you can separate it. It's not going to go anywhere. And then you just put that hand over the area that you are feeling discomfort. And look at you. I mean, my goodness gracious, we're like a big old medicine ball there when you're trying to do that.
Yeah,
none of our listeners can sing that.
Yeah,
But
they can.
But if you take that, now, if you take that energy the next step of it is that we could look at things like Qigong. And we could go in and say, okay, well, this is the energy. And then you can start to use that to bring it into like Qigong would. So what I try to do is to introduce the concept and create a folder in their mind called energy. So when somebody says, oh, well, you're trying energy medicine, their mind doesn't freak out.
Yeah.
And then they can, based on their curiosity or the mystery behind it, then they can go in and say, okay, so maybe I need to learn more about chakras, because chakras seem to be kind of that source of that energy from what books say. Actually, the source of the electromagnetic field of energy of who we are is the activity of our cells. The chakras are just monitors.
Right.
But so I approach it, first of all, just that you can heal. You choose where you want to start. And the most important thing is that you are willing to commit to it and to stay with it and to know beyond a shadow of a doubt that this is part of your healing. Second thing is I introduce the energy to them. And then the third part of it is I'll go in, maybe because what they share and how I do my work, it'd be like, we're dealing with physical things. I said, okay, let's go in and look at physically.
Yes.
And then what we do is we go in where their mind wants to go, give the mind what it needs. And then the mind is an interesting character. It's like, oh, okay, well, you got it. And it goes off to something else. But if we don't give the mind what it needs, then it's going to continue the message. This is broken. This is broken. This is broken. You're not listening to me. You're not hearing what I'm saying. I'm going to turn up the volume. I'm going to turn up the pain. You need to see somebody. You need to do whatever. That's what's happening. And so that's the way I approach it. How about you?
Well, I think it's a great question. I think I approach it from, well, practically where you're at right now hasn't worked. So we need a different entrance point. We need a different way to access your body's ability to heal. So what if we consider that emotions are a vital sign? What if we consider that trauma and traumatic events could be a vital sign? What if we consider that we can follow those vital signs just like we can when we palpate your pulse that goes up with when you're anxious, your blood pressure that goes up, your palms that get sweaty, you know, you get anxious and you get that your hair stands on the back, up on the back of your neck. And so then when you're feeling those things, what if we stop for a minute and see what that's trying to tell us? Because so far, just knowing you're going to end up with a stomach ache or a tension headache, needing a tablet, needing a prescription, now you need an MRI or physical therapy, we haven't really done anything other than just kind of go in different circles for maybe trying to help things. So we have to step back and look at perhaps why this is occurring. And frequently knowing that the body, if we stop thinking that we have to over treat the body and meet the body where it's at and support it, we get a different understanding.
Yep, exactly.
And so, and then I, you know, and I really haven't talked too much about energy yet. And probably it was because of the, you know, the brick and mortar that I was in.
Yep.
And the insurance system that I was in, and the fact that folks were there for what I would say real answers, you know, and you know, I had to deliver because I worked for someone, right? And there were certain expectations. I worked for an employer, for example. But when I've had my own practice, and certainly what I'm doing now, completely telemedicine, virtual, whatever, all bets are off now. And because the other stuff, even in the functional medicine world, is dissatisfying to patients. It's just not working.
Mm-hmm.
One day a bag of supplements, the next day another bag of supplements. Now a new test, no answers, no real diagnosis, but we're just going round robin with supplements to try and feel better, and they don't, and they get frustrated. And so I think we have to bring more of a wholeness to the understanding that, okay, maybe we need to do something different.
Mm-hmm.
And that's how I, you know, introduce it. And then when they're open to that, then, you know, then I talk about, especially when I do the self-care and connection, and talk about the chakras and the energetics and the mind-body connection and changing our thoughts and healing our thoughts, which then affect our body. And they actually, I teach them to do things themselves. So when they go home and do the exercises, they come back and they say, well, such and such happened, and I didn't know what to do. So I just did the self-care and connection, and all of a sudden I felt better, you know? And so then that experience begins to shape and change their paradigm.
It does, and it puts something measurable, tangible in their
Yes.
folder called energy, or
Yes.
called self. We could even change it and say, okay, well, we're going to open up a new folder called self,
Yes.
and we're going to see the self beyond the physical body.
Yes.
And the thing that I think it's important that to know about the working in the energetics of who we are is that healing is in small increments. And it's designed to be in small increments so it doesn't create chaos and panic in the mind and chemical chaos in the body. So if someone comes, and it rarely will they come to me for that, because they're at the place very straightforwardly that they've been the medicine route, they've been the herbal route, they've been all the things, and they're not getting any better. So in many cases, I have an advantage over who I am and the way that I work. But one of the things that I'll say to people, if you don't trust the doctor, the pill won't work.
That's right.
The other part of it is that the supplements, when you're tested at that time, kind of like acupuncture, when you do it at the time, that's exactly what your body needs. The energetics of your body needs that.
Mm-hmm.
But once the body gets what it needs, even to the most minute energetic quality of it, it heals and it goes to something else.
Yes.
And if we recognize that, then we would take away the pressure or relieve the pressure within ourselves that energy medicine doesn't work, but it's a process, it's a methodology.
Right. So that would almost make me think of, instead of doing a lot of supplements, instead of doing a lot of, things that we take and buy, I would think about, how could we affect our thoughts?
Mhm.
How could we use our thoughts to release the chemicals in our body that we need for healing?
Absolutely. Well, simply, we can do it through affirmations,
Mhm.
words. We do it through words. I'm working on a book right now, which is a book I honestly never even ever in my wildest dreams believed that I would write.
Mhm.
That's called Divine 911, Why Prayer Heals. And prayer is an affirmation.
Mhm.
Prayer is a poem. Prayer is words.
Mhm.
And if we recognize that thoughts are vibration, thoughts are words and combination of words enmeshed with an emotional chemical charge to them,
Mhm.
then what we can do is something as simple as let's talk to ourselves differently.
Yes. Yes. And
But
so,
we have to do it enough. Excuse me for interrupting you.
yeah, no.
It's important that we do it repetitively enough that it actually the body experiences the benefit of it,
Mhm.
and the brain says, releases all the endorphins and everything that needs and says, oh, this is all is well, this is good. Now we're reprogramming, now we're retraining, now we're truly healing.
Yes.
Healing requires us to be to participate in our own healing. It's not going and saying fix me. Energy medicine isn't going to a beautiful healer that does energy work and saying heal me. It's like, and it's not saying I'm broken, it's just like, show me how I can be energetically attuned.
Yeah.
Heart math even does this in their heart congruency. So yes.
Yeah. And I think people are kind of stuck in that concept. Well, I paid my copay. It's up to you to fix me. And copays aren't that much. So
No,
I
they're
would say
not.
I would always want to say, but rarely did. Rarely, but occasionally, well, you get what you pay for, like seriously. So, but thinking about, why it's been of interest to me as a physician is because I just ran out of pills and potions to give.
Yep.
And, I ran out of um, just staying when somebody is when a patient is stuck with what I call the minutia of
Mhm.
their symptoms, or the minutia of what the signs are, whether it's a mild abnormality in a lab, or a known risk factor, or just something that won't go away, a nagging symptom of pain or something. Underlying that is not going to be typically a vitamin, a supplement, an herb, um, something like that, a fish oil. It's going to be, what are we thinking? What
Mhm.
are we feeling? And I think that those two things, our thoughts and our feelings, are equal, are really a vital sign. And I think that, because if we look at the two systems, I call them two systems, but like with our thoughts, that's the mind body connection. It goes into the pineal gland, which drives our hormones. And then our
Mhm.
chakras is what we feel, because that's what we absorb. And those are the subtle energy areas. And that's our connection to the outside world that we take in. And then our thoughts are making that connection to the mind and body. And
Mhm.
so we've got the psychoneuroimmunology, putting all those three things together, that really is driving the energetics. Or maybe it's not driving, maybe it's responding, maybe it's tempering, maybe it's, um, guiding, um, how we are as humans and how we are energetically.
Yep.
And that's kind of the container it functions in.
Absolutely. And thoughts first and foremost, well, I'm going to kind of generalize, which is always a little bit risky, but thoughts are tied to our nervous system.
Mm-hmm. Mm-hmm.
And emotions, feelings are tied to the muscles.
Okay.
In my world. So if our thoughts are ill, then our nervous system is going to respond differently.
Mm-hmm.
If the emotions attached to those thoughts are fear-based, I'll just use that as a generality, then what's going to happen is the pineal gland, the immune system, is going to respond in an overt way versus in the way that it's designed to constantly be monitoring. So if we looked at kind of the dynamics of illness and we looked at using energy, and we realized that words are energy, thoughts are energy, and that activates the nervous system, which changes practically everything about us, is that what we can do is we can just go in and say, okay, so um, tell me a common thought that you have.
Me?
And then we add the caveat. Tell me a constant thought that you have about yourself.
Mm-hmm.
And one of the things I found in the 40 some years I've been doing this, one of the things that it said so many different ways, but basically it says, I'm broken and I don't know who I am. So it goes back to that big proverbial question, who am I? And if we change the way we look at healing to the point that who am I? You are energy first, physical second. It opens the door of the mystery to be able to go in and to become curious and to become creative and use our imagination and want to read and want to learn and want to talk to different beautiful healing modalities and stuff. And it's just like opening up a Pandora's box of greatness and goodness.
Mm-hmm. Yeah. Yes. Yes. And, for those who are scientifically inclined, wanting research, here's a couple things that are very interesting. 1964, George Freeman Solomon, he wrote the book Emotions, Immunity, and Disease, came up with the concept of the psychoimmunology. Then that was followed up by Robert Adder in 1975, if I'm saying his name right. He expanded on Solomon's work. And what they used they were using lab animals. They were using some rats, and they used a cyclophosphamide injection, which diminished the immune system. And at the same time of giving the injection, they gave the lab animals a saccharin flavored water. And so then the follow-up step was step 2 of the experiment was just to give the lab animals saccharin flavored water. And then they measured the same immune stimulation or the immune modulators they were looking for, and those were diminished just based upon the saccharin water. And so that's where we came up, and that was the first documented evidence of like a Pavlovian type of response that affects the mind body. And that was, that was a number of years ago. That's like almost 60 years ago, 59 years ago, half a century ago.
Yeah.
And we're still grappling with the concept of our thoughts affect our body. Our thoughts, if a person has cancer, well, should I, change the way I eat? Should I look at my lifestyle? Oh, no, it has nothing to do with that. I mean, I don't know how physicians have arrived at that answer or stay at that answer. And it's disconcerting, it's disquieting, because patients really want to then for sure engage because they're faced with a major diagnosis. And I
Exactly.
just think of how much we could educate sooner. We could change paradigms sooner by just accepting the fact that we're energy, that our thoughts affect how we feel, affect how our body functions, and that if and when needed, medicine can supplement and support the body to heal. And so it becomes a part of it instead of the mainstay.
Right. Well, and the gift of medicine is that the gift of medicine, I'm not going to split hairs. The gift of medicine is that it gives the body the chemical reprieve and the brain the chemical reprieve it needs to be able to reset itself.
I agree 100%. That I tell people that all the time. Yes.
And that is the benefit of it. Is it a cure? No, but there are tests. The wonderful part about medicine, I say this to my clients all the time, is use the technology, use the information.
Yes.
Do the testing if you need to. If that's what the doctor requires, that's the way they're trained to do it. But the thing is that we have to realize that medicine and what it offers in the prescriptions, supplements and what they offer is that they are just giving the body the reprieve to reset itself to do what it already knows how to do.
Yes.
And once the body knows what it needs to do, and it finds that homeostasis, whether it's even in the smallest of magnitude, it's healing.
Yes. It is. It is. And I think, I talk to folks all the time that it's not a failure to require a treatment, a medication.
No.
It's what the body's requesting now because it's where we are. And sometimes they get to that point, even myself included, because I'm human, of like, oh, yeah, I could have done something different before, but here I am now. This is what we got to do to move forward in a way that's healthy and appropriate and things like that. And then you begin to work on the energetics, the mind body, the emotions, the lifestyle, that type of thing.
Right.
And I don't see it as a derogatory result to require assistance.
No, absolutely. And the thing is that what we've done in the way the pendulum has swung is that now medicine, in many ways, the doctors I work with, they'll say to me, Carol, sometimes I don't feel like I'm any more than a used car salesperson.
Yeah.
And yet the underlying impetus of that doctor is to want to be a healer. And it's like they offer these things and people are rejecting it, which is it's what they do. And so what happens is more people, I work with them that says, okay, I'm just going to do alternative. And it's like, okay. And so what are you going to do when your mind doesn't accept it's working for you? All it's going to do is turn up the volume. It's going to fixate on nagging at you, using pain to be able to say something's wrong, something's not working the way it's designed, not necessarily not broken. And the mind turns up the volume. And you try more and it turns up the volume. And it turns up the volume until you reach a place with the pain that you say, you know what? This hasn't been working. I need something else. And then we go to the doctor. But what if we approached it from the standpoint that what the medicine offers gives the body that breathing space it needs in order to find a way to heal itself along with everything else you're doing? Now we've got true healing.
Right. We do. And I think we have to go back to begin talking to ourselves, our patients, our clients, our colleagues, that we're all energy. I mean, this coming week, I get to speak to the osteopathic physicians, family medicine physicians in Michigan. There's a summer conference. That's what I'm talking about. I'm talking about trauma and the chronic illness, but really I'm laying out the patterns and the discussion that we're energy. We need to really get to that point. And I think it can also reinvigorate physicians' careers in a way that's
absolutely
meaningful to work with folks. And
absolutely.
It's just
they're committed. They truly, in the very core of a physician, it is not about money. It is not about status. It is not about prestige. It is about the fact that they want to help.
That's true. And yes, and by and large, they are folks who are driven towards transformation, by and large.
Absolutely. Absolutely. So I want to tell a very quick story because you talked about you being human. I'll make it short. So I'm going to do this. 25 years ago, I decided that I needed to work on a treadmill, and I'd been on my feet teaching and for 4 weeks straight and blah, blah, blah. My feet were hurting like crazy. And I bought this treadmill, and dang it, I was going to use it because I knew that that was going to help my vitality and my energy. So I got this treadmill. I didn't stretch my feet. I had the wrong shoes on. I got on the treadmill. 30 seconds, literally 30 seconds into it, my feet go, oh, this is not good. My mind goes, no, it says that you need to do this for at least 30 minutes. So I stayed on that thing for 30 minutes and my feet were screaming. I get off of it the next morning. I can't even hardly get out of bed, and finally realized I had plantar fasciitis. And so then it was like, okay, I tried all the different things. And then I thought, oh, this is not working. I need to go see a podiatrist. So I go see this podiatrist, and he says to me, he says, well, I can give you a cortisone shot, or I can give you high dosages of ibuprofen that'll help the inflammation. So here we go. I arrogantly looked at him and said, and why would I do that? And he looked at me and he said in a very stern way, it's the only thing that's going to help you. And I said to him, well, thank you. I appreciate your opinion. And off I went. 3 weeks later, I was sitting in front of him and he said, so Carol, why are you here? And I said, I'll take whatever you give me. Just give me something. Let me be able to walk. So sometimes even in our humanness and in our thing, the mind, our part of us that thinks we have all the answers. And I think to myself, golly, if I'd done that 3 weeks before, I'd probably be 3 weeks ahead of the curve. So we're human.
Yes, we are.
And I think the point of my sharing that is the fact that I think if we really want to look at healing, the concept of healing, and looking at all the different modalities that are available, then I think that it's important that we stop seeing things as being at odds with each other.
Yep, no more alternatives. It just is. I don't want an alternative. What I am.
It is. And we know how to heal. The body knows how to heal. And if the mind gets in and says, well, I'm not going to do that because I talked to so-and-so and they're not doing it and everything, and we buy into that, okay, we buy into it. But let's use every tool we have available, including ourselves, most importantly, to heal.
Yes. Yes. I agree. Excellent. All right. Well, another episode in the books here of Cosmic Health and Wellness. This one all about understanding energy medicine. So thank you again, Carol. I look forward to our next episode and more fun talks. All right.
All right.
And thank you to all of our listeners today. We appreciate you being here as well. Thank you for joining us on the Since You Put It That Way podcast. Today's episode was written and produced by Crowded Table Productions. Technical editing, Malin Long Lopes. Sound editing, Jonathan Fiegel. Music, The River Jordan, written and performed by May Erlewine. Please rate and review our podcast as well. We appreciate your feedback, and hey, be positive, share the love.